another episode of Teens No Cap. I'm your host, Charity Chafee. I'm a licensed mental health counselor in the state of Massachusetts, and I specialize in the treatment of teens and their families. Welcome to our newest episode. I am going to go a little bit into some of the content that I'm building for my new course, and I'm going to talk a little bit about standards of care when working with teens. So as a teen-focused therapist, I hear a lot of people talk about how they either love working with teens or they hate working with teens. And a lot of people that say they don't like working with teens, part of that is because they don't like working with the parents. And I feel like that kind of gives the parents a bad rap, because I do think that when you're seeing teens or when you have a teenager who's in therapy, you're actually putting a lot of trust into that relationship, that they're going to be a supportive a supportive person and giving really good guidance into what your teen may or may not be going through. So I think it's a lot of strength when parents are willing to admit that their teen needs support, in the same way that I think it's a big deal when teens ask for or inquire about therapy or other sorts of support services. So as a teen-focused therapist, I think a lot of the things that I have been frustrated about in some of the cases that I've worked on, or some of the things people have told me about, really comes down to what I'm calling the standard of care in working with teens. A lot of people, clinician-wise, will say that they feel like teens are just like adults, or teens are just like children, but I firmly believe, and it's a hill I will die on, that teens are actually their entire own subspecialty, and that they aren't really in the child mentality, and they're not really adults yet because of brain development. And so I think we've done them a disservice in the field in talking about them as kind of conjunction or add-ons to other populations. And instead, I would like us to focus more on the fact that teens are their own subspecialty, and because of that, there are specific standards of care if you're seeing teens or if you work exclusively with teens that you need to have as part of your practice. So I'm going to back up here, and I'm going to talk a little bit about my initial journey into working with teens. When I was in grad school, I felt like I wanted to work with women with borderline, and I felt like that would be a really good population for me. I was really excited about it, and I got my first job working in community mental health with an amazing supervisor. Shout out Aditi if you're listening, and she was fantastic. And she really helped me understand my work in different sorts of populations with different age groups, and I actually would never have started working with teens unless it was for her encouragement. And so when I initially started in community mental health, I was very nervous about working with teenagers because I felt like they wouldn't like me, or that I was like maybe too close to my own experience as a teen, and that it would be maybe too triggering for me. But what I found out is that working with different populations, I was good at it and I could do it, but I really, really loved working with teenagers. And I had a way to work with them that was very kind of inclusive of the family, and talking about the bigger expectations and the needs of the family, the expectations of the family, but focus on the teenage lens. So when I was working in community mental health, I was able to work in a broad range of levels of care. So I was working in residential. I did some Johnson in-home therapy, which is a service in Massachusetts. And it really helped me kind of gather my lens and try to understand more of what was really helpful in moving teens through treatment. Because I do think that there are a lot of people that get very frustrated with teenagers. They're like, they're not making the progress I want them to make. They're not doing it the way I would want them to do it. And then ultimately you end up, as the therapist, being another parent to them, and not necessarily their clinical support and their therapist that is separate from the family system. So a few of the things that I really saw that were helpful when I was working in community mental health were the involvement from parents. And oftentimes I think in grad school, when we're talking about inclusion of parents, it's a lot of just like, oh, family therapy, right? Family therapy is a thing. But unfortunately, if you put a teenager into a session with dysregulated parents, you are actually just recreating the system that they have likely been a part of if nobody can regulate themselves. And in grad school, they don't really teach you about the regulation and how someone is kind of like ready for being added into like a family treatment setting. So in the work that I did, a lot of the in-home therapy stuff was working with the teen and then working with the parents, and then really kind of like slowly building dyad sessions and working on different components of not necessarily the specific issues that they were talking about, but more about the structure, the scaffolding, the expectations, and the shared collaborative values that they had as a family. And what I found is that when you add in parents that are able to regulate and hear their kids, and you add in teenagers who know that that is a safe space and that everyone's working and we all make mistakes and we're human, you have a lot more productive conversation and treatment moves forward. So when I'm talking a standard of care for teens, I think that one of the biggest standards of care should be inclusion of the parents at regular intervals. Now, that can be different depending on the level of care or the intensity of the client. But I do think that initially when someone is in session in therapy, that you're meeting with the client, but then you're also meeting with the parents and really addressing any of their skill deficits or talking about how they manage situations so that they can do a better job. Because let's face it, nobody prepares you for teenagers, and teenagers are their own wild situation. And so oftentimes parents feel very unprepared in stepping into teenagerhood with their teens. And I think that because we have a kind of a lack of focus and a lack of education, people make it up during the tween years and it might feel like they're doing okay, but then they hit full on teen years and they're like, what the fuck am I doing? Right? So if we're not bringing parents into treatment and we're not making them part of the process and we're not talking about how they can be part of the process and we're not talking about their own kind of accountability and how they add to or detract from different situations that are happening, we're not actively treating the family system. We're treating the teen in a vacuum. And as we know, teens don't live in a vacuum. So we really have to have inclusive parent involvement, and that can mean a lot of different things for a lot of people. But when I usually start with a new family, I'm meeting with my teen client, I'm meeting with the parents once or twice that first month, because I really want to get an understanding of the deeper dynamics that are happening, and I want to understand how the parents are responding to things, how they're supporting, what the collaboration looks like. When you have that lens, it's a lot easier for you to see how all of those things play together, and then you continue that work, right? And you continue to kind of like nuance and massage the different things that are coming out of it, and you're really helping build teen capacity and understanding and parent capacity and understanding of behaviors, of development, of scaffolding, of really helping their teen like move through the growing edges of being a teenager. So first standard of care to me is always parent involvement in treatment. The second standard of care for me is really your policy and how you're bringing people into treatment. And so, for instance, one of my standard of care is that when you're working with teenagers, there should always be a separate parent intake from teens. It's great to kind of have a little bit of together time sometimes, but that's not necessarily how you want to start treatment. When you're working with someone, you want them to be able to create a relationship with you. You want them to feel the safe space, understand the structure, understand what their expectations are in treatment, and at the same time, you want to get good information and good support to parents that are involved. If you do a joint session, what often ends up happening is that there is this kind of dynamic that you're maybe a little bit seeing, but you can't really ask the questions you'd want to ask, and they're not maybe really being fully transparent about different things that are happening. And then when you separate them, you get a lot of good information. So I strongly believe that when you're doing an intake with a teenager for purposes of treatment, that you should be doing an intake session with the parents, specifically focusing on their parenting style, the things that they, want to improve upon, don't, think is a big issue for them. And then you want to meet with the teenager and you want to talk to them about what's happening within the family system, within their treatment, what goals they want to have, etc. That way, in those sessions, you could ask very specific questions that and likely get a better or more authentic response, because they're not trying to mask or kind of camouflage some of the comments that might come across in a different way if their teen was sitting right next to them. So having those two family sessions, those two separate intake sessions, really allows you to kind of tease through different things and understand the bigger picture very quickly, versus if you had multiple intake sessions with teen and parent both present, the likelihood that you're getting an honest understanding or experience is probably a lot less. So standard 2, always separate parent and teen intake. Third piece for me is actually all around your intake packets. So when I'm working with a new teenager or I'm working with a new family, I send out a very specific parent-based intake packet. At the same time, I'm sending out a very specific teen-based intake packet. I want the teenagers that I work with to sign off on all of my policies and procedures the same way I would with an adult. It doesn't have to happen legally speaking because the parent can consent to that. But what we're working on is we're working on the skills, the understanding, the awareness, and we're building some of the scaffolding for how they can invest in treatment in the future. We're showing them that process inside out, and we're kind of allowing them to speak to their own autonomy and to like experience what that process is like. When you send out those two different packets, they're very tailored to teen development versus adult or parent development. And that is purposeful because we don't want to send a teenager the same packet that we would send to parents. We want them to be very like kind of specialized in terms of A, what their roles are, B, the lens we're using, and C, covering all the things in a way that makes sense. So my policies and procedures written for teens are spoken in teen language. They're written in a way that teens can understand them. They're maybe a little bit more concise because I want them to be able to get it, understand what I'm talking about, and not have to be like, I don't know, I'm just going to glaze over and sign this, right? And with parents, I talk a lot in my intake packet. I write different examples of HIPAA. I do a lot of different components breaking down treatment, the involvement, the expectation, consultation time, all of those pieces, because again, we have different roles in treatment, and I want to set the stage in my policies and in my paperwork and my intake packet for all of that treatment to happen. Thing 4, and one of my top ones, is that I believe, and this is going back to my community service agency days, is that when you offer some wraparound services and you're readily able and available to step into different meetings like IEP meetings, 504 meetings, school meetings, and you're really kind of like, A, showing that client that you're showing up for them and that you're there to be supportive, B, you're getting a greater sense of the landscape and the pressures that they might face. And C, you're able to really help them understand and identify different skill sets that they might want to work on. Because even though teenagers look maybe in body form like they are an older grown person, their brains are still like very in the process of being developed. And so they don't always have the words to say things. They don't always see things from all the different lenses that we can. And when we can offer those perspectives, it really helps them see the different ways that they can have really productive and efficient conversations. So I love to attend IEP meetings. I love to go to different school meetings. I love to connect and collaborate with psychiatrists and school guidance counselors and college counselors and anyone who I think I could benefit from checking in with, or that the client would benefit with. Now, with those collaborations, I always give the option for the client to be present in those conversations because I want them to have the voice. I want them to understand what I'm talking to them about, and I want them to understand what the outcome is of those things that we're talking about. And oftentimes I do have teenagers that are like, I want to be a part of my school meeting. I want to have this conversation. I want this to be something that we talk about. All good. Then I think that there are times that teens don't necessarily want to be the one giving the feedback about certain situations, and that's something that we can work on. That's a skill. But if I need to step into a space where I'm advocating, professionally with someone, I will do that as long as the teen and I are on the same page about what that looks like. So I think collaborative treatment is something that we could do a better job at. And so I think one of the standards of care, if you're working with teens, is to make sure that you are regularly reaching out to collaborative partners, whether that's school, it could be the psychiatrist, it could be a quick email, it could just be like, hey, just want to check in, see if you need anything, see how things are going. And it could be just like, things are going really well, thank you so much, I'll be in touch if there's any concerns. Or it could be like, hey, actually, do you have time to chat? Because I have this question and I think it could be helpful, right? But of course, when we're working with teenagers, we want to be, and this is standard 5, open and honest about the conversations we're having and the content of those conversations. I ask for permission and consent to discuss different things with different providers or parents or etc. because I don't want the teenager to ever feel like I'm talking about them behind their back. That's never a good situation. Instead, I want to preemptively discuss, hey, I'm talking to your psychiatrist next week. Here are the things that I would like to discuss. Do you have thoughts on them? Do you think these are important? What information can I share? Do you want to be a part of this meeting, right? The more we're giving them practice and autonomy to be involved in this, the better they're going to be being their own advocate later on. And especially because we sometimes like to role model for people about how to have difficult conversations and how to advocate for ourselves. And teens actually learn a lot about watching their parents, their therapists, their school people, whoever, their friends, engaging in some of those conversations. Thing 6 for me in a standard of care is to make sure that I or you have policies around texting and outside contact. It's amazing to me sometimes. I know a lot of people open private practices and they are just like, oh, I just have the minimum, I have HIPAA, I have whatever. But if you're working with teenagers, I do think it's really helpful to have that as part of your intake packet. And everyone is a little bit different in terms of phone usage, so I can't tell you exactly what to do. But I think if you don't have it written down, then you don't have a policy to stand on when there is an issue that comes up. And so oftentimes when I'm talking to someone who's new to working with teens or someone who wants to work with teens, I really try to have them think about all of the different things that could go wrong and to have policies and procedures around some of those situations. So for instance, like when I'm thinking about taking on another client, I might have a moderately impacted client in front of me who's suffering some like anxiety, some depression, some minor self-harm. But the thing is that like, not every teen is going to come in high risk, but I do think that every teen has the capacity to be high risk based on the development, based on the social situation. And I think sometimes things can very quickly go south. And so as a provider who works with teens, I have a lot of different policies that are meant to support and wrap around people so they understand what they can expect in those situations. And as a business owner, I think it's always better to be a little bit stricter than it is to, be like really lax and then not necessarily have the policies and the procedures to stand on. So my last standard of care that I'll talk about today, but I have many more, is to actually find a form or to have some kind of like quarterly way that you are giving them an opportunity to check in on progress, on feedback. I actually have a form that I send out to all of my people on a quarterly basis. So every 3 months they get this form in the EHR that's basically asking them, how the last couple months went and if there's any feedback they have, anything that they want to tell me that maybe they haven't disclosed so far. And I understand that in some areas that might be seen as like, oh, you're allowing them to like avoid talking about it or you're allowed this. But I do think that sometimes there are things that are easier to write down than they are to like actually tell someone like in person. So for instance, I had a client who, when we're talking about self-harm, it's really hard for them to actually label that behavior. And so sometimes there are other words they use for it, or there's other actions, or there's like sound effects even sometimes that come up in terms of saying, I cut last night, there's a different phrase for it. And so sometimes having that check-in form allows them to share information with you in a way that is like, I think a lot about this, we should talk more about it. And then they're communicating that, and then it gives you the ability to bring that up in session and to talk more about it. So why standards of care? Standards of care in a lot of ways for certain populations is like pretty written uniform. I think that one thing that I've really noticed that's missing is that because teenagers are often lumped in with children or they're often lumped in with adults, there is less focus on standards of care that are very specific for teenagers. And I think that everyone does their work differently. I'm certainly not here to judge. I think there's lots of different ways to reach people and to support people. And at the same time, I very much think that there should be kind of some nationwide or worldwide standards on how we work with teenagers. We can't ignore the fact that the teenagers of today are going to be tomorrow's adults. And I think that we have to offer them scaffolding and support that's going to really help them get to where they need to be or want to be. And so I think standards of care creates a little bit of cohesion and a little bit of understanding in terms of what everyone should be offering if they're working with teens. In the same way where I feel like if you are working with teenagers, you should be trained in teen, right? I think that there are a lot of people who love the work and are really excited about working with teens. And if you don't have the training or the lens or the understanding or the supervision or the consultation space, sometimes can quickly turn into a space that can be harmful, that can be detrimental, that can not necessarily give treatment the way we would want it to. And so when I'm working on my standards of care and I'm talking about them today, it really is talking about what is the minimum that people can expect in treatment if they're enrolling their teen, and how can we get to a space where those things are more of a collective experience and offer. And so that way we know that if someone is new to working with teens or wants to work with teens, we can very quickly be like, great, here are your standards of care, here are the things you should be aware of, and here are things that you really should have as a necessity as part of your practice. The last thing I'll say, I guess I'm on number 7 for standards of care right now, also being acutely aware of any laws and regulations, school or otherwise. I think I'm specifically talking about school, specifically talking about mental health treatment, age of consent, all those things, and then any sort of mandated reporters. I think people get really freaked out when their teen acknowledges or admits to something in a session and they're like, crap, I don't know what to do with that. So if you're working with a teen right now and you don't know what the age of consent is in your state, or you don't know kind of the minimum required to file, or you haven't had extensive training in that, here's your sign to get that. Those are all things that as you've learned them, they should go into your intake packet. They should go into your policies and procedures to make sure that you're really covering yourself and that you've been very clear about what constitutes, let's say, a mandated report versus what does not. And also talking about confidentiality with parents. Where does that fall in your state? It's hard to comment because every state is a little bit different in terms of what their expectations are. Some states have Juliet laws for age of consent, and some of them are like very clear. And so if your laws are a little muddy, definitely reach out for like a legal consultation. It's never a bad thing to ask in advance. But if you don't understand the school systems that your teens that you're working with are in, if you don't understand the educational laws, the IEP process, the 504s, if you don't understand those pieces, you are not necessarily being the most helpful for a teen client. And so I would say that there could be a very big disservice by not being well trained in your statutes, in your laws, in your state regulations and supports. And so I think as a standard of care, that should be something before someone takes a client on, they should be aware of all of those pieces. So those are my kind of top standards of care when you're working with teens. I have lots more because I'm building an entire course based on this, but I do think that I'm curious about other people's kind of standards of care in terms of teens. If you work with teens, if you don't work with teens, what you're curious about, and I would love to talk more. I do think that at the end of the day, I'd love to see more awareness on teen-specific treatment, and which is why my entire brand exists. So if you haven't had a chance to check us out, please visit www.teensuncharted.com for more information about working with me, consulting with me, and any of the exciting trainings I have coming up. So for those of you who are listening, I do have a harm reduction training coming up on April 10th. I'd love to have you there. I also have another training that I'm developing that's going to launch in September that I'm very, very excited about. So if you are curious about trainings, or you want to work with me, or even if you just want to like coffee Zoom as a provider, I would absolutely love to touch base. So all the socials are listed below. I'd love to have you in the community on School. It is a free community for providers who work with teens. Again, you don't have to have every person on your caseload a teenager, but I am really working hard at trying to build community spaces for people who love working with teens, whether you have 1 teen or 10 teens. I do think it's a very specific space, and you deserve support when you are working with teenagers. And sometimes it's nice to have other people around that understand the chaos and the crazy that happens when you're working with teens. I certainly know that it's nice to have people to depend on to ask questions and to just have good case consultations with. So I would be really curious what your thoughts are on the standards of care that I've listed so far, and if you have any kind of competing standards of care, or if there are things that you would add to the list. So drop them below. Don't forget to like, follow, subscribe. I can't wait to have more of these conversations. But that's it for today. Happy Friday. Have a good weekend.